Where to go?
My name is Dionisio. This is my trauma assessment.
Yep.
You guys, nice and safe.
Yes, it is.
Tell me what's going on.
You respond to a 28-year-old male who was working under a car when the jack failed and the car fell on top of him. He's pinned under the vehicle when you arrive.
Okay. I have proper PPE on. Before we begin treating the patient, I'm going to want the fire department to go ahead and lift this car off of him because we cannot do that.
Yeah.
And I'm going to immediately contact ALS to come over here because we will need assistance. And so one number of patients is one. Mechanism of injury is he got pinned under the car he was working on. I am gonna use C-spine stabilization for this because of mechanism of injury.
Yep.
Yeah. So I'm gonna move on to my primary assessment right away. So is there any major bleeding that I need to immediately take care of?
No.
Okay. Get down here. I'm gonna look at his airway. Is he talking to me?
I'd say no, but he's alert.
I'm gonna ask how alert is he?
He's very anxious. He's kind of out of it, but he's awake.
Okay, so he's coming in and out of consciousness, but he's talking to me. The airway's painted and there's how is his breathing? Is he the ventilation?
Rapid and shallow.
Rapid and shallow, guys. That's bad. Because of that, I'm gonna want to consider high flow oxygen via a BVM. Because of the quality of his breathing, I'm just going to ask for a pulse oximeter right away.
His pulse ox is 86%.
Okay, this is a high priority patient. This is not a stay in play situation. We're going to want to get ready to go pretty soon. You said there's no major bleeding, but what does his skin look like? And
his skin is mottled, cool, and diaphoretic.
All right. Okay. And how is his pulse?
His pulse is 130. He's tachycardic and bounding.
All right. That's pretty bad. So right now, he's flowing he has shallow and fast breathing, so we have high flow oxygen.
And how often are you going to BVM him?
We're going to use the BVM every 5 seconds. And because of the color of his skin, I'm going to throw a blanket over him to better his perfusion. Then
how does that better his perfusion?
By warming him up.
Yep.
And then am I ready to move on to my secondary assessment?
Okay.
Okay, I'm gonna palpate the face, look at the face, inspect the mouth. Okay, and then before I begin anything else, I'm gonna ask for, will he be able to tell me his history, or is he not alert to do so?
Well, what history are you asking for?
I'm gonna ask for his sample history.
Sample history? No, he can't tell you. All you know is the events. So the signs. You already see the signs.
Yeah.
Allergies, medications, past pertinent history, last oral intake unknown. You just know that before you got there, you got pinned under a car.
So unfortunately, we're not going to be able to take his sample history because he's not alert enough. So I'm going to move on to my secondary assessment right away.
Okay.
Looking at the face, the mouth, the nose, and the ears, and also his eyes. Do I see anything? And also, I'm going to feel behind the spine.
Okay. You see no injuries, no fluid or blood in the ears, nose, or mouth. The eyes are bloodshot and they're bleeding around them.
Okay. That's not a good sign. I'm gonna feel his neck, look at his neck, and also feel behind it, that neck region.
Okay. You have JVD and tracheal deviation, and the C-spine has no obvious injuries.
Okay. All right. So. Now that I know that, I'm going to keep moving down. I'm going to look at his chest, palpate it, and I'm also going to check for those lung sounds. Do I feel, see, or hear anything?
Well, you have a bruising imprint from the car. There's no open wounds, but the chest is not symmetrical. You have crepitus and possible flail segment on the left chest.
Okay.
Lung sounds are diminished on the left side and present on the right.
All right. And then I'm going to keep moving down that stomach region, and I'm going to feel it, look at it, and I'm also going to feel behind it.
And what are you assessing for?
I'm assessing if there's any...
What's the acronym you use? For cut or something.
Oh, any hemorrhaging? Or no, any lacerations?
What is the whole? What is the
Okay,
whole?
I'm
thing?
looking for
There's so much random information to read on them.
hold on. Damn.
That was just like random reading stuff.
I'm looking for deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, swelling,
Yep.
abrasions.
There you go. Okay, and you did the abdomen. Yeah, bruising is present. All four quadrants are rigid.
Mm-hmm. Okay. And then I'm gonna move on to that spine area, or not the spine, the
Pelvis.
pelvis area.
I'll just give it to you. Okay.
Okay. And I'm also gonna ask him if there's anything wrong with his genitalia.
It says the pelvis is stable. Patient is incontinent of urine and stool.
Okay. And then, just because of the mechanism of injury, do we know if was the car like on his legs or anything, or are those completely untouched?
Those were untouched.
Okay. And then I'm just gonna feel for that pulse, and I'm also gonna check his CMS. How is his CMS?
His CMS is good. There's no decap BTLS. Pulses is present, but very weak and thready bilaterally.
Okay. And, then
And are you going to check it on one or both legs?
I'll check it on both legs.
You might as well do it.
Okay. And anything there too?
No.
Okay. Then I'm gonna want to check his the CMS on the arms. Is there pulse?
The arms were also just not. They weren't scathed, so the CMS is normal. The pulse is present, but very weak, and thready bilaterally.
Okay. And then can I get a set of vitals?
Yes, you're. Let's see. Wait, do you want your second set or your first set of vitals?
I'm gonna want my second set since I'm already
You've already given the BVM.
the oxygen therapy.
Your blood pressure is 86/72. Your pulse ox is 85%. Your heart rate is 120, and your respiratory rate is per BVM ventilation. So how often do you want to give those?
Every 5 seconds.
Yep. Okay, and now, what do you want to do to transport the patient?
I'm gonna want to put him on a backboard. I'll have a C-spine on, a blanket, and the BVM going every 5 seconds. And I'm gonna want to get a set of vitals every 5 minutes on the way to transport.
Mm-hmm. And what can you suspect the injury to be?
I'm gonna suspect there's a detention pneumothorax. There's
That's kind of all I want.
okay.
I just kinda want
Do I have to say yeah? There's detention pneumothorax.
Yeah, that's good. All right.
And then shock. That's a
What
shock.
do you? Yeah, you got that. What do you want to tell the driving ELS crew?
I'm gonna say. Does it even say how old the patient is?
Let's see.
I don't think it does.
Patient is 28.
Okay, 28-year-old male who was pinned under a car. Tachycardic, rapid shallow breathing, possible tension pneumothorax, and blood modeling. And I've been using a BVM every 5 seconds, and blanket.
Yeah.
Okay, is that
All
good?
good?
Yeah.